Good evening, everyone, and thank you for joining tonight's kickoff webinar. We are excited to be putting this on, and we really do appreciate your time. I know if you're on the East Coast, it's kind of late into the night, so we'll try to be as efficient as possible with our presentation. Tonight, guys, and then of course our submissions, assessment, and deadlines, and then our future webinars. I'll begin by introducing myself. My name is Carly Yon, and I'm a Healthcare Education and Outcomes Research Fellow with Clinical Education Alliance. I'm a second-year fellow, and this is also my second year doing the VIP case competition. Super excited. I did year, and I'm excited for you guys to be learning about all the different functional areas within the pharmaceutical industry. And I'll pass it to Hannah.
Hi, my name is Hannah Kassler. I completed a 2-year management operations fellowship with the County of San Diego. Recently just transitioned into a full-time role, but this is my second year on the VIP case competition. Super excited for this year. We have a couple new members, and so we're excited to have everyone join us. And I'll pass it to Boyan.
Thank you, Hannah. Hi, everyone. Welcome. My name is Boyang. I'm a 1-year program in medical affairs with Howard AbbVie Allergan Aesthetics program. With that being said, this is my first year. I am one of the new members. Super excited for this year, and I'll pass on to Manav.
Hey everybody, my name is Manav Patel. I'm also a first-year fellow at CEA with Carly, one of the Healthcare Education and Outcomes Fellow. I'm also one of the new team members. And with that, I'll pass it to Tiffany.
Hi everyone, my name is Tiffany and I'm currently a National Student Officer for the VIP Case Competition and Scholarly Activities for IPHO. This is my second year in my role and I'm also a P4 student at Rutgers University.
And now I will pass it back to Hannah to go into the competition overview.
So if we're new here, the first thing that we'll talk about is just kind of what the VIP case competition is. The purpose of it is to navigate the core elements of a drug development process into a cohesive and comprehensive plan for you all to bring a new molecular entity from phase 1 through approval and beyond. So with that being said, we focus on different functional areas. So the key ones that we focus on are clinical services, regulatory affairs, medical affairs, marketing, and commercial. And if you've done it before, then you probably realize we have a new one this year. And if you haven't, then this will be like this going forward. But our new functional area that we are adding this year is patient advocacy. That's a big component nowadays. So we're excited to add this to the competition, and we'll give you all the information that you need to be successful with this functional area. So getting into some competition updates, the first thing that we'll go through is grading. Go next slide, please. So big things, there's 2 main submissions. We have the midpoint submission and the final submission. So both of those have their own areas of the distribution of grading. And then another thing is professionalism. So there's professionalism built into the midpoint submission as well as separate professionalism for the final submission. All of this is talked about in the rubric. So if you ever have any questions about it, you can reference it there. And then something else is that we do offer extra credit for the final submission. So for the final submission, if it's one, you get 1 point extra if it's 1 week early and 2 points if it's 2 weeks early. And then to hit on professionalism, exactly what that is. So you'll need to have all functional area leads. So every functional area lead needs to be a national member. I will say that we've gotten some questions about if the overall lead can take on a functional area lead, and that's absolutely okay. Just each functional area needs to have a lead, and that's really to help you all make sure that you get all of the things that you need from that functional area, and to help guide you. And all of those are required to be national members. So we recommend that everyone on the team is a national member, but it's only required for the leads. Each chapter is required to have a chapter designated competition consultant. We started this a couple years ago, and it's really dramatically improved the final submissions as well as what all you get out of the competition. There's nothing better than talking with someone that's actually gone through something like this or has hands-on experience. So that could be anyone within the industry. So it could be a current fellow or an industry pharmacist, perhaps someone for your alma mater, but it doesn't have to be. Just to help you with the competition, any questions you have, help guide you. The name of that person will be required at midpoint. So after midpoint submission, you'll get a form. In the form, you'll be required to tell us who your competition consultant is. Of course, deadlines must be met on time. And this is my big takeaway. The submissions must be appropriately named. So we have naming conventions in the competition guide. This is really for us to be able to expedite grading and expedite getting you your grades back. So just be sure that you look over the competition guide. Sorry, it's like allergy season. And then another thing is links must be accessible. So this team right here does not grade all by ourselves. We have people that help us grade that are taking time out of their days to help give you guys feedback to make you successful in this competition. And we have to make sure that they can access your links. So make sure that you do that. And there's in the competition guide, a step-by-step guide on how to do that. And then of course the post-competition surveys must be completed for midpoint and final submission. Getting more into midpoint, we are, if you've done it for the past couple years, this isn't new, we're continuing it. Instead of the midpoint historically being bulleted question and answers, we're going to continue where the midpoint submission is going to be kind of like a mock-up of the final submission. So you will make slides. It doesn't have to be everything that the final submission is, but the whole point of it is to help you be halfway done to the final submission, basically, for midpoint. So we provide you the questions that will be required to be answered, but instead of just listing out the answers, putting it into the slide format is really helpful. And we saw amazing final results last year. And so we're really, we decided to continue on that. But remember that we do give you the questions and you will be graded on those questions. So make sure that you answer those. Those are found in the competition guide as well. And then another thing is you will not submit anything other than slides. So no need for a recording. That's just for final submission. The only thing that you will be submitting for the midpoint is your slides. And then getting into webinars. So we have a list of webinars within the competition guide, and I believe the backgrounder when we talk about the timeline. This year we're doing things a little bit differently in terms of webinars, and I think we'll get into that at the next slide. But as far as webinars go, just know that. And then also, this has come up in the past, so just so you guys know, do not post your presentations anywhere after this. Really, that just does you all a disservice for the next year's competition. And also, we want everyone to be as unique as possible and really be able to use all the creativity that they have. So please do not post after the competition. We'll get into the challenge point in a little bit. Okay, so this is what I was talking about with webinars. This is a live webinar, so we are on here with you. There will be webinars that are posted that are recorded. This one will also be recorded and posted after this. So all of the webinars you will be able to look at on the IPHO website under the VIP case competition page. The next webinar we have is next week. It's bonus webinar. It's a background on our mechanism of action and everything that you need to know to be successful. It's also at 8 p.m. Eastern time. All of the live webinars will be. Then we have our functional area webinar recording. So we have a recording for every functional area just to help you be successful within those areas. And we will be adding the new patient advocacy as well. Then we have the best practices webinar, and this is really all of the questions about basically housekeeping that you would have any questions about and help you clear up any confusion running through the competition guide. A new thing that we're doing this year with the general Q&A webinar is that we are having you all submit questions. So this way you're able to submit questions. You don't have to do it live. You can come up with all the questions that you and your team think would be helpful and submit those through a form that was sent with the link to this webinar. What we're really hoping out of this is that you get all of your questions answered and you don't feel pressured to do it in front of everyone else. So if you have any questions today, if you have any questions next week, we've released that and we will be closing it about a week before 10/29. So that's when we're going to release that webinar. So we will record a question and answer to all of those for you and release it on 10/29. And then the last webinar we have is the general Q&A before the final submission. So this is after midpoint submission, but before the final. And also the challenge point is revealed. So if you're unfamiliar, the challenge point is kind of something we throw into the competition in the middle to kind of mimic real life, where we give you a scenario that, hey, this might happen, or let's say this has happened and you have to figure out how to incorporate it or figure out how to change your plans around it. Again, just to give you a real life scenario and to help you get that experience. Again, written resources, we have spent hours and hours and hours going through these to answer all of the questions that you might have and to lay everything out to be successful in the competition. So please, please, please utilize the backgrounder and the competition guide. Most all of the questions should be able to be answered through them, but we are always here. We all have access to this inbox. If you ever have any questions, please email us directly at the vipcasecomp.ipho@gmail.com. All in this email is also available in the competition guide in the backgrounder as well. And I'll pass it over to talk about this year's competition.
All right, thank you so much, Hannah. So now we're going to review some more information about the case. Most of this information can be found in the VIP case competition guide, so I highly recommend that you and your team go and review that if you haven't already. So here's some background information included in the prologue. So ulcerative colitis is currently the most common form of inflammatory bowel disease with two primary peaks of onset, the first being ages 15 to 30 years of age and then 50 to 70 years of age. The incidence and prevalence are highest in North America and Northern Europe, with the reported incidence ranging from 9 to 20 cases per 100,000 people annually, and the prevalence ranging from 156 to 291 cases per 100,000 people. In the United States alone, the annual incidence of ulcerative colitis is estimated at 12.2 to 15.1 per 100,000, while the prevalence ranges from 181.1 to 286.3 per 100,000. The economic burden is substantial, with annual costs estimated between $8.1 billion and $14.9 billion. So pathologically, ulcerative colitis is defined by continuous inflammation of the colonic mucosa, beginning in the rectum and then extending proximally. Common clinical features include abdominal pain, diarrhea, rectal bleeding, and urgency, and symptoms that significantly diminish the quality of life. A diagnosis established through a combination of clinical evaluation, laboratory testing, endoscopy, and histology, with colonoscopy and biopsy remaining the gold standard for confirming diagnosis and determining disease extent and severity. So patients with mild disease or patients in remission may be managed conservatively with supportive measures such as antidiarrheal agents or acetaminophen for pain. Pharmacological therapy often begins with 5-aminosalicylates, and then for more moderate to severe disease, escalation in corticosteroids, immunomodulators, or biologics is common. So there's a variety of different biologic and small molecule therapies available, including TNF alpha inhibitors, anti-integrins, IL-12 and IL-23, and IL-23 inhibitors, JAK inhibitors, and S1P receptor modulators, and those are central to inducing and maintaining remission. We'll also go into a little bit more about the background of IBD and ulcerative colitis next week during the webinar as well.
Thank you, Tiffany. So now we're going to dive into the case overview. So based upon the recent expansion of therapeutic innovation and growing interest in novel biologic targets for immune-mediated disease, your company has decided to undertake a comprehensive development plan that will support a BLA for Vipokibart as a treatment option for moderate to severe ulcerative colitis. Your team will need to carefully plan all development activities for UC as the initial indication, ensuring that the clinical development program is designed to support the anticipated final product labeling, which include but not limited to appropriate patient population to study, key efficacy and safety endpoints to evaluate, dosing considerations, and other regulatory requirements. So the next slide, please. Yes. So as we mentioned before that as a team, we will be tasked to take the drug product through all 4 phases of clinical trials and the different functional areas, including clinical science, regulatory affairs, medical affairs, marketing, commercial, and patient advocacy. And you can find more information about this on page 13 to 15 of the competition guide. And I really want to highlight about the different areas of focus for the submission. So for clinical science, you will be responsible for design and execution of the clinical trials. Regulatory affairs will be responsible for compliance with regulatory guidelines. Medical affairs will help with scientific communication and post-approval activities. Marketing commercial team will help form the strategies for product launch and market penetration. And then for patient advocacy group, you will be responsible to build strategies for partnership with advocacy organizations to protect access, address affordability, and improve health outcomes for patients and caregivers. So with that being said, kind of look together, as Hannah mentioned before, like we have the timeline layout here. So after today's webinar, we will have the bonus webinar next week with more information about disease state and things like that. And then we have recorded webinar for general Q&A on October 29th. Remember to submit your questions. And then the key midpoint submission, it's on November 16th this year. And then feedback will be given by December 14th. And by January, there's another general Q&A and challenge point question on January 7th. And then the last final submission is due on February 15th. And by April, you will have, we will announce the winner and will release all the final feedback. So now I will pass on for helpful resources.
Yeah, so now let's look at everything you'll need, or if you need help, on where you can reach out in the competition resources section. Next slide, please. So all the competition resources you'll need will be found in the VIP case competition guide under the competition resources. There's going to be things for every functional area: marketing, medical, regulatory, and especially the FDA guidance on the developing biologics is going to be helpful for your clinical development and regulatory affairs sections. There's also tips on how to organize your team and best practices. And then if you need any technical help on recording over your PowerPoint for your final submission, there's a video on how to do that. And lastly, make sure you leverage your network of professors, professionals, and fellows to really put together your case competition, and also the competition consultant can be helpful to enhance this. Now for your functional area resources, like we've mentioned, there will be multiple webinars and recordings that you can find to be helpful. The next one will be next week, but then we'll also have one on the 29th, which will be a recording, and then one on the 7th in January after your midpoint submission. And then we'll look at all the questions we received and answer all of those and have those sent out in a recording for you to access as well. And then also all the resources are available in the competition guide on the IPHO website as well for all the functional areas and the best practices webinars.
And I'll pick us back up and end with a discussion about our submissions, assessments, and our deadlines. So with the midpoint submission, Hannah kind of touched on this a little bit earlier, but this will be worth 21 points or 20% of your final score. And like she mentioned earlier, we really did find it useful for the students last year and very beneficial to really focus on kind of finalizing their PowerPoint within the midpoint, just so you can get as thorough a feedback as possible for your final submission. What is being submitted here? It will be questions from the competition description across all 5 focus areas in just PowerPoint format. So like I said, it should be a draft of your final presentation rather than bulleted answers to just the questions. Where to submit, there are instructions in the competition guide, but you will start with creating your Google Drive folder. And then this will be due Friday, November 16th by 11:59 p.m. Eastern Time. Late submissions will be knocked 4% of their competition score per week, and that is not to exceed 16%. So it can't be more than a month late. And then the final submission will be worth 85 points or 80% of your final score. What is being submitted here, that will be your PowerPoint video in MP4 format and your slide set. This will be graded based on the rubric, and they are attached in the appendix of the competition guide on the IPHO landing page. I do want to remind everyone that submissions lasting longer than 45 minutes, and I know this is challenging, including with the additional functional area, but we really want to mimic a professional setting. So submissions longer than 45 minutes will be penalized at a rate of 1% deduction per minute over. And then where to submit, this will be under that same folder that you created with your midpoint folder. So once uploaded into the folder, please send a link to the case competition email to serve as the timestamp. And when will this be due? Again, that will be Sunday, February 15th by 11:59 p.m. Eastern Time. And final submissions received after the due date will be docked 5% of their overall competition score. Due to quick turnaround as for our judges, we ask that any submission received after February 22nd, 2026 not be considered. And then for your professionalism points, these will count as part of the final submission score. And this will be a post-competition survey, the use of a competition consultant, and compliance with all competition rules. So this is like an all or nothing type deal for you to gain your professionalism points. Again, the grading rubrics, both midpoint and final, are located in the appendix of the competition guide. We really want to you guys to demonstrate an appreciation for the different functional teams within pharmaceutical industry and the value that pharmacists bring within each role. And we are looking at the depth of your project and proper utilization of your resources included in that competition guide, as well as your video presentation quality. In terms of the winner, they will be announced on April 2nd, 2026, and the top 3 finalists will receive a complimentary IM 2026 registration. Will receive 10 free registrations, second 5, third 3 registrations. And again, our next event will be our bonus webinar scheduled for the 15th of October. Of course, all live webinars are at 8 p.m. Eastern Time. And that will be, like Tiffany discussed, more background on ulcerative colitis and the mechanism of action of the molecule. I just want to take some time to acknowledge all of the wonderful people and my teammates that have helped put this competition together. A big shout out to Tiffany, Hannah, Boyang, Manav, and then of course James, Jerry, and Megan. And a really big thank you to Santa Fe for sponsoring this year's VIP case competition. So I want to end by saying that due to, not having enough time to cover everyone's questions, we wanted to go ahead and just post here the QR code to our Google form, and please submit any questions by the 19th to that form, or you can email it to vipcasecomp@ifo@gmail.com, and we will be happy to answer any of your remaining questions that you may have, since I know tonight is a little bit limited. But that's all for now. I'll leave it on the screen for just a little bit longer, but if you already have what you need, have a good evening, and thank you so much for your time.